sitting here talking to myself, but nice to see you all, and welcome to the third module of the Cancer Care Review training. My name is Juliet Norwood, and I'm the South East Wales Regional Nurse for the Macmillan Primary Care Cancer Framework. And I'm also a practice nurse in a GP practice here in Cardiff. So most of you may have heard me speaking in Module 1 about myself and how I came to be speaking to you today about carrying out holistic cancer care reviews. And today I'm going to talk through how you can start carrying out cancer care reviews in your own practice. Can you just double check with everybody, with Sue? Can you see the presentation okay?
Yeah, everything's well. Thank you.
Lovely.
Yeah, we can see it. Thank you.
Thank you. So as we do on every module, we'll go through the housekeeping first. So could you please mute your mic while the presentation is running, and there will be opportunities for questions at the end. And I think a couple of our team will be keeping an eye on the chat, so you just write in the chat as we go along. So if you wish to ask a question at the end, please use the raise your hand button and we will allow you to ask your question. And don't forget to take the button down afterwards. So as I said before, you can use the chat function for questions, which the team will try and answer as we go or at the end. And please be aware that the presentation is being recorded to share with colleagues who are unable to attend. So before talking about how to carry out cancer care reviews, it's really important to highlight once again about how important you can be in supporting people with cancer at a time that is very difficult and often lonely and frightening. And COVID-19 means that people living with cancer need our support more than ever. So to have a look at the objectives of this module, they are for the cancer care review to be relevant to people with cancer during the time of COVID-19, to have an understanding of what a holistic cancer care review is, to have an understanding of possible processes of carrying out a holistic cancer care review, and to introduce different tools which can be used when carrying out a holistic cancer care review. So I'm just going to give a brief overview of the National Cancer Survivorship and Macmillan Recovery Package. And these are a series of interventions which, when delivered together, can greatly improve outcomes for people with cancer. And the cancer care review is one part of this. So there are 4 main interventions to support people with cancer. And the first one is the Holistic Needs Assessment and associated care plan. And you may have heard Aleri talk about the Holistic Needs Assessment in her personal story in Module 1. And the Holistic Needs Assessment is a questionnaire with the aim of finding out what is important to the person with cancer and devising a care plan with the patient. And this should be carried out in the acute setting. And a copy should, in an ideal world, be sent to us, or given to the patient and sent to us in primary care. And the second intervention is the treatment summary. And this is a communication tool, a document between primary care, secondary care, and the patient about their cancer. And the third main intervention is the cancer care review. So the cancer care review is carried out in primary care. It's a discussion between the practice nurse or GP or other clinician about what matters to the person with cancer. And you may wish to use the Holistic Needs Assessment questionnaire to carry this out. And I'll talk about this in more detail later on. And the fourth intervention is supporting self-management. And there are a number of courses that do support self-management. For example, the Macmillan Hope course, the Expert Patient Programme, Moving Forward with Breast Cancer, and so forth. So you can see that if all of these interventions are in place, sorry, could somebody just mute their mic, please? Thank you. You can see that if all these interventions are in place, how a person with cancer can be fully supported throughout. But today we're focusing on the cancer care review. So here's a definition of a cancer care review. So it's a discussion between a patient and their GP or practice nurse or other clinician about their cancer journey, and it helps the person affected by cancer understand what information and support is available to them in their local area, and to open up about their cancer experience and enable supported self-management. So before I started carrying out holistic cancer care reviews in my GP practice, I carried out an audit of cancer care reviews that were being done, and many of them were just one-line statements with comments such as managing okay or blood pressure okay, or a statement about treatments or medications that people were receiving. And these are not holistic cancer care reviews. This is not finding out what matters to the person at that time and helping guide them to relevant support. So if we go back to Larry's story, if someone had sat with her and asked her what actually mattered to her, then she might not have experienced the depression that she did have. So I've put in definitions of holistic needs assessment and cancer care review here, just to clarify. So the holistic needs assessment is a questionnaire completed by the person living with cancer, and it allows them to highlight the most important issues to them at that time to inform the development of a care plan. And the cancer care review is a discussion between the GP, nurse, or other clinician about their cancer journey. And as I said before, you may wish to use a holistic needs assessment as a tool to carry out a cancer care review. So why is a holistic cancer care review so important? Many people leaving the acute setting feel as though they have fallen off the edge of a cliff. And this is outlined in the Macmillan Patient Experience Survey of 2016. And I've heard this so many times in my work with the framework. During the time in the acute setting, people have lots of appointments, lots of contacts with specialists. And when they do leave the acute setting, they don't have the contacts and the visits to the hospital. And this kind of time can be very lonely and frightening. And they have to create a new normal. And this is where your support is really vital. So many people have unmet needs, and many people with cancer have unmet needs, and these may be physical, emotional, practical, family relationship concerns, etc. At least 33,000 people in Wales are facing poor health or disability after a treatment for cancer, and at least 22,000 are having sexual difficulties. At least 22,000 people living with or beyond cancer experiencing chronic fatigue. At least 15,000 people are living with mental health problems, which can include moderate to severe anxiety, and around 13,000 are living with moderate to severe pain after curative treatment. So I've been a practice nurse for over 20 years, and I've always been very confident talking to people about their diabetes, their asthma, the COPD, hypertension, etc. But I have avoided in the past talking to people about their cancer. And I did feel this was the same for other practice nurses. So I carried out a questionnaire to 45 practice nurses in 2017, and the results showed that none had attended a cancer course in the past 3 years. And the nurses' confidence about talking to people with cancer was very low. And the main reasons they gave were lack of knowledge about cancer, they didn't know where to signpost people to, and also a lack of time. So here are some of the reasons the nurses gave me for avoiding talking to their patients about cancer. But with the numbers of people with cancer living longer with cancer, we can no longer avoid talking to them about their cancer. So I'm just going to talk now to the practice nurses online, as I know the majority of you are practice nurses. And I will say that you're ideally placed to carry out holistic cancer care reviews. And why is this? Because you're already carrying out chronic disease management, and in many ways, cancer can now be seen as a chronic disease. You're also used to carrying out holistic reviews. Our training is about holistic care, and you're very good at this. You're also good at signposting. It is part of our role. And this is a very rewarding role, as I found out. So the one thing I do say to anybody wanting to carry out cancer care review is that you don't need to have a great deal of knowledge about cancer to carry out a cancer care review. The important thing is to get the conversation started so that people living with cancer don't suffer in silence, and also that you know where to signpost people to for further support. So what does a cancer care review involve? I just want to once again reiterate that a cancer care review is not a quick discussion that is carried out on diagnosis with the patient. It is a holistic review that is offered to patients, usually between 3 to 6 months after diagnosis. And this is the time they've usually finished their acute treatment, and often the time they feel as though they have fallen off the edge of the cliff. So the cancer care review is a discussion with the person living with cancer and the clinician about any concerns they may have during or after their cancer treatment. And appointments usually take about 20 minutes, and they're designed to help people to open up about their cancer experience and understand what information and support is available. The review covers a range of holistic topics, including social, psychological, and physical conditions. And together you can go through any concerns they may have and jointly agree a plan that supports self-management, signposting to other places for conditions that you're not able to deal with yourself. So before carrying out the cancer care reviews in your practice, you'll need to prepare. This is really important. And this involves identifying and inviting people living with cancer to the cancer care review. But we are not talking large numbers when it comes to cancer care reviews. It's estimated that for every 1,000 patients on a GP list, between 4 and 5 will be diagnosed each year. So ideally, you'll be able to offer a cancer care review within 6 months of diagnosis, and this does fit in with the QOF. So you could work with your admin team to identify all patients diagnosed with cancer in the last 6 months. If you can, it's a good idea to review each of the patient's notes to check if it would be better to defer the invite to a later date, and remembering that the numbers will be small. So your admin team could be in charge of the list and send you a regular list of any new cancer diagnoses and work with you to ensure that the reviews are carried out. And we talked before about allowing appointment slots of 20 minutes for each cancer care review. And the cancer care review could be done face-to-face or over the phone, especially at the time of COVID. Looking at tools, there isn't one way to carry out a cancer care review. And I recommend that you decide on a process that works best for you and your practice. The important thing is to open up the conversation. So I'm going to demonstrate 2 tools which you could use to carry out the review. And the first one is the Macmillan Cancer Care Review template, which is embedded within both Vision and EMIS systems. So how to access, this is the Vision Cancer Care Review. It is embedded within the Vision system, as I said. And so when the patient record is open in Consultation Manager, you go to the Vision Plus toolbar, which is displayed, which is, you can see here on the slide. You click the arrow on the side of the yellow cross and navigate to the clinical templates. And there you will find the Vision Cancer Care Review template. So the benefit of using this template is that the information will be correctly read coded, but the downside of this is that it is not patient-led. So the template is also embedded in EMIS, as you can see on this slide. And if you do have trouble finding this, it's worth talking to your practice manager. So another way to carry out a cancer care review is to carry out a holistic needs assessment using the National Cancer Survivorship Initiatives. That's always a tongue twister. The concerns checklist and care plan. And here we have the concerns checklist. There are other tools available too, the distress thermometer, which some of you may have heard of, but essentially the tools are similarly used for a patient-centered approach. And as this is so patient-centered, this is my preferred method. But the downside of using this tool is that you will need to ensure that the information recorded on these forms is read-coded into the patient's notes. This should also be scanned into the notes. Macmillan have developed an electronic holistic needs assessment tool, the EHNA, but it's not widely used in primary care yet. So a copy of the care plan can be given to the patient, and if possible, a copy could be sent to the patient's cancer nurse specialist in an ideal world. So how it works. The concerns checklist can be sent to the patient in advance. It could be given in the waiting room or given to the patient when they come into the room. They identify the top 3 issues concerning them that day. And this really hones the conversation in an efficient way as to what really concerns the person. So following the holistic needs assessment, a care plan can be devised between the patient and the nurse. So you can download both of these templates on Macmillan Primary Care Cancer Framework website, which is on the Wales Cancer Network website. And I'll give you the website details a little bit later. And I will also be sending the website addresses to you in an email after this session. So this is a quick overview of the process that you may use in your practice. Just remembering each practice is different and you need to find a method that works for you. So also remember, we're not talking about large numbers of patients. Once again, it is estimated for every 1,000 patients on a GP list, between 4 and 5 will be diagnosed each year. So firstly, a letter of serious diagnosis is received at the practice. This can be read-coded and sent to the GP or practice nurse. Then the GP nurse checks and gives an initial call to the patient, but this is remembering this is not the cancer care review. The admin puts the person on a recall for between 4 and 6 months. And once a month, a list can be sent to the nurse or other clinician who can check that it's appropriate to send out an invitation letter to the patient. Then the admin can send out the letter to the patient for a cancer care review and include the concerns checklist template if you're using it, and ask the patient to book an appointment. As stated before, it can be face-to-face or a telephone appointment. And then the patient books in for the cancer care review, and I've put down query 20 minutes, whatever suits you. And non-responders are followed up by the nurse or the admin. So here is an example of a letter that can be used to carried out to invite patients in to have a cancer care review, and this is on our website. As I say, I'll send out the details of our website later. So fingers crossed, I'm now going to show you a video clip of myself and my colleague Amanda Pallister we're carrying out a cancer care review using the Holistic Needs Assessment and Care Plan, and this was recorded pre-COVID-19. But as I say, it can still be done down the telephone. So fingers crossed, this is going to work. And if somebody could let me know if you can actually hear this. Can you hear this, somebody?
We can hear a little bit. It's not very loud.
Yeah. Okay. Let's see if I can turn it up a bit. I think it gets a bit loud. It's about 10 minutes.
I'm Juliet. Hi, I'm Amanda. Thanks for seeing me today.
Oh, lovely, as I say, lovely to meet you. So I understand you've been having a bit of a hard time at the moment. Can you just tell me a little bit of what's been going on?
Oh, it's just been a really hard few months. My husband's been diagnosed with a non-Hodgkin's lymphoma. He's a fireman, so previously really physically active and healthy. So it's all come as a bit of a shock, really, to be honest. Yeah, it's a difficult time.
So I see that you've filled in a just as a way of having a talk through what you've been going through. It might just be an idea to have a look at the form that you filled in. Thank you for bringing that along.
Oh, that's okay. Thanks.
So I see you've ticked 3 different points on here.
Yeah.
One is the money or housing, the other the children, and your other one is sleep problems.
Yeah.
So which would you say is the one that's affecting you most at the moment?
Well, I think mainly it's the money and housing, because he's currently on sick, obviously, with everything that's going on, and it's 6 months full pay, but then after that it drops down to half pay for 3 months. And my big worry is that we've got 3 children, and I don't work because I'm the baby's only 2, so I'm at home with the baby. How are we going to cope when he goes to half pay? I mean, we've got a mortgage, bills, food to put on the table. And obviously I can't discuss it with him because he's ill and he's got enough to be dealing with. I'm just really worried about the future and how we're going to cope financially.
Have you discussed the finance with a benefits advisor at all?
No, I haven't spoken to anybody.
Have you heard of any of the benefits advisors?
No, nothing.
Because there is a Macmillan Benefits Advisor in the local hospital.
Is there?
And they've got a cancer information centre there, and they do have a
Okay.
benefits advisor attached to.
I never knew that. I think
So-
because we've been so busy getting, once we've had the diagnosis and then the treatment plan, that you kind of let the finances slip, and then suddenly it hits you. Then you think, oh, what's going to
Yeah, of
happen?
course.
So it's not something I've really had time to deal with, and I didn't know there was this help out there. So
Right. Well, if I give you the telephone number for
yeah.
the benefits advisor, how does that sound?
Oh, absolutely fantastic. Yeah,
Okay.
yeah, really good. Thanks. Yeah.
It's also might be worth having a look at the website for the Macmillan.
Please.
Yeah, and they've also got a helpline there that you can ring.
they?
I can give you the number for that as well.
Brilliant.
It might be
Brilliant.
worth
Yeah.
having a look on that.
It's good to know there's help out there. Yeah.
Yeah. Okay.
Yeah.
So let's have a look at. So you've ticked children. Which would you see as your next?
Well, the children.
Okay, tell me about that.
I mean, I've got
Tell me about
3
your children.
children. They're
Have
lovely. I
you?
mean, yeah, they're 7 and they're 5 and they're 2.
Right.
And the 2 boys are the oldest, and they're in school. My worry is that because Dad has always been quite active, playing football and messing about with them in the garden, and all of a sudden now he's not able to do that. They are asking questions about what's wrong with Daddy, and I don't know how to discuss, Daddy's illness without frightening them. I just don't know how to broach the subject, or I really could do with some advice on that, really.
Okay. Macmillan do some booklets, illustrated booklets, story booklets for children, which can help you start having those conversations.
Oh, right.
So,
okay.
I don't know if you want me to get some sent to you, but it might be a good idea to sit down with the children at night or whenever you read to them, and the booklets can help you start the conversations.
Yeah.
I don't know whether that would be. Would you want me to get those sent to you?
Yes,
at all?
please, because I think that's part of it. I don't know how to start the conversation, because obviously never been through anything like this before. So yeah, and we do bedtime reading every night, so what would be a good opportunity to be able to maybe start them conversations with them?
Absolutely. And it might be, once again, you've got if I give you the Macmillan website, it might be worth having a little look on there.
Yeah, okay.
Yeah?
Yeah, it's really helpful, yeah.
Good. And the other problem you've highlighted there are sleep problems. Do you want to tell me a little more about that?
Yeah, I'm just not sleeping at night. Obviously, I'm worried about my husband. I don't know what the future holds of the treatment. I'm worried about finances, the children. And basically, my mind is just going over and over all these worries, and I just cannot sleep. And then that's having an impact, then making things worse, because finding obviously day-to-day life more difficult then with lack of sleep. It's making me irritable, tearful. I just feel like I could perhaps cope a lot better if I could sleep.
Yeah, that's understandable. Can I just ask, do you do any physical activity? Do you walk? Do you?
Well, I do take the baby out in the pram a lot. I do try to get out and get some fresh air, and I must admit that when I have gone out, I do feel a lot better.
Yeah.
Just getting out and getting some exercise does seem to help. But I feel that I haven't really got anyone to talk to, because I tend to mix with a lot of other mothers in toddler groups, and none of them are going through anything like this. They don't really understand what it's like. I just feel quite isolated and lonely, and with no one that understands my situation.
Yeah. So, I mean, one thing that is in this area is a carer support group where you can go along, have a cup of tea, talk to people who are in a similar situation to you.
Okay.
I don't know. I mean, I know a lot of people do find that very helpful. I don't know whether you'd be.
Would I be able to take the baby along with me?
They'd be more than happy to have the baby come along as well.
Okay.
Absolutely.
All right. Well, yeah. I mean, that would be good to have other people just to talk to. Yeah. Yeah.
If I give you the details, information about that, how does that sound?
Oh, that's brilliant. Thank you so much. Yeah. I just didn't know all this was out there.
There's a lot out
I
there.
feel quite
it's
alone.
knowing,
Yeah.
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 Absolutely.
Yeah.
I mean, we do have a counsellor attached to the surgery, and there's a bit of a waiting list that that you could refer yourself to if you wanted to. I don't know whether you'd.
I don't think I'm really ready for a counsellor. I don't know if I need a counsellor. I think I just need to try and deal with things, you know, like the money and the sleep and the ways how I can explain to the children what's happening with their father. I think once I've dealt with them and I feel I've got a bit of control over things I feel are out of control, then I'll feel a lot better. But maybe that's something I could consider in the future, but not at the moment.
Yeah.
Basically.
No, that's absolutely fine.
Yeah, if that's all right. Yeah,
Yeah,
but thank you. Yeah.
No, that's fine. So just to recap on what we've discussed today, so I'm going to give you the number for the Macmillan Benefits of Cancer, the Macmillan and the Macmillan website, and their national number. Okay, and I'll get the books for the children ordered and sent to your home address.
Thank you.
That's okay. And we've also discussed the carer support group.
Yeah.
Okay, so I'll give you that number as well. How does that sound to you?
Oh, just amazing just to know that there's help out there and there's people I can speak to. Thank you so much. Thank you.
Yeah. You know where I am. Okay. I don't know. I mean, whether you'd want me to whether come back and see me in a couple of weeks and see how you're doing, or I could give you a phone call. How does that sound? I mean, it's up to you.
Oh, that's good. I think because we don't know what's happening with my husband's treatment, and I don't know where I'm going to be with the children. Rather than making an appointment now, would it be possible you could maybe give me a ring and then we see how we go from there?
Yes, of course.
That would be good.
Of course.
Okay. Yeah.
All right.
Oh, thank you. Thanks so much.
Lovely to meet you.
Thanks.
All right.
So once again, thank you for Amanda Pallister for doing that video with me. So for more information on the holistic needs assessment, it is worth having a look at this website. Once again, I'll send this to you. It does have show some more scenarios, but these scenarios are secondary care focused, but they will give you an idea. And here is our website. I will also send this link out to you, but if you Google Welsh Cancer Network Cancer Care Reviews, then you should get there. And on our website, we have collated a lot of information that you may need to get you up and running with Cancer Care Reviews. It's got tools, resources, signposting information links, and you can find the concerns checklist and the care plan here. And for further resources and to help you carrying out a cancer care review, you can go to this website. And once again, I will send this out to you. So I go back to what I said earlier on, that you don't need a great deal of knowledge to start talking to people about cancer. The important thing is to get people living with cancer to talk to you and talk to them about their concerns and know where to signpost them to. But some knowledge about cancer and consequences of cancer is important. And Macmillan offer a number of short, simple online courses to get you started. And you'll need to sign up, but it's worth having a look at this website and doing some of the short courses that they do offer. This just shows you some of the courses that they do offer. There are also a number of resources available to support you in carrying out your cancer care reviews. So My Macmillan is where people can go to access the online community, which can offer a lot of support for some people affected by cancer. And it offers a great deal of information about Macmillan and its services. So that's My Macmillan. Now, B Macmillan, it's all a bit confusing, but My Macmillan, this is B Macmillan, and this is where you order your leaflets. And Hayley Phillips will talk more about this next week and in a lot more depth. And here are some examples of the different leaflets that you can order from B Macmillan. and once again, our very own website. So knowing what support services are available locally is very important, is a very important part of what you can offer. You can find starter signposting packs and links to useful leaflets and informations from national charities on our web pages. And we're fortunate to have Hayley Phillips, Southeast Wales Regional Nurse for the programme, presenting on signposting next week. So I've put together a list of 10 top tips for carrying out cancer care reviews, and I will go through these one by one. So discuss with the whole practice team. It's good to have everybody on board. Secondly, the support of your admin team and receptionist is important, and it's a good idea to have one named person from the admin to work alongside you. Thirdly, there is no one set way to carry out a cancer care review. Find a method that works for you, your practice, and your patients. Fourthly, don't be afraid to change and adapt your method as you go along. And remember that cancer can now in many ways be seen as a chronic disease, and utilize all those skills you already have with chronic disease management. And at the start of the conversation, you can explain that you're not an expert in cancer, but you're there to listen, to support, and to signpost. And you can start, it's important to start gathering a list of local resources that you can signpost people to, and to review this regularly. You can make a list of all the different read codes that you will use. And remember that you may be nervous carrying out your first cancer care review. Just start. As with anything, you'll soon have your own method. And remember when you first carried out your first diabetic review. And number 10, you may want to think about doing an annual cancer care review. So that is the end of my talk for today. If there are any questions, please do put your hand up now. And I don't know if there's anything in the chat that we wanted to go over, but here is my email address, and please do not hesitate to get in contact with me about anything at all. I'd love to hear from you.
Hi, Julia, it's Hayley.
Hi, Hayley.
Hi, well done. I always love that talk. Nothing in the chat at the moment.
Okay, does anybody want to ask any questions at this stage? No, nothing for now. So yes, we do have a hand come up. Sorry, bear with me.
Hi. Can you hear me?
I can hear you.
Okay. Your video clip was really good. But you were chatting with the patient's wife. Do you offer them a separate appointment for a patient wife, or is it who turns up? You know, how do you set that up?
What I found when I first started carrying out cancer care reviews, I was sending out appointments just to the patients, but then over time it did evolve, and people heard about the service that I was providing, and I found that family members were also coming in with their concerns. So it was sort of an evolving process, and I think it's